Good afternoon and welcome to the Healthy Living series. Today's presentation is on hyperbaric oxygenation therapy, and our presenters today are going to be Kelly and Brandon from our wound care center here at North Kansas City Hospital. The presentation will be recorded and be posted on our hospital's YouTube channel. We will give you time for question and answers after the presentation. You can type them in the chat box. So if you have questions, please don't hesitate to let us know, and we'll try to get all the questions answered. I'm going to turn it over now to Kelly and Brandon, and thank you for the presentation.
Thank you, Sandy. I am going to go ahead here and share my screen. Kelly, do you want to introduce yourself and your credentials while I get this all running?
My name is Kelly Coleman, and I am the clinical coordinator at the Wound Healing Center. I am an RN, and I'm also a hyperbaric tech and a certified wound specialist.
Thank you. My name is Brandon Arnold. I'm the director of outpatient wound care and hyperbaric oxygen therapy at North Kansas City. We'll go ahead and get this started here. So this is our Healthy Living series on hyperbaric oxygen therapy. I'm going to take the first few slides and then I'll hand it over to Kelly and we'll keep on going through. So just to give an overview of today's topics, we're going to start with a brief history of hyperbaric medicine. We're going to move into how hyperbaric oxygen therapy, commonly known as HBOT, is administered. We'll talk about indications for treatment, a few success stories our program has had, the accreditation that we hold in hyperbarics, a little bit about our team, and then we'll have question and answer session at the very end. So I'll go ahead and get started on our next slide. So I am going to just read through this slowly. One thing that we often hear from our patients is that they believe hyperbaric oxygen therapy is relatively new in the last 20, 30 years or so, which it is not by any means. So a brief history of hyperbarics. Hyperbaric medicine began in 1662 when British physician Nathaniel Henshaw built the first pressurized room to treat pulmonary and digestive conditions. Use of oxygen therapy stalled until 1788 when they used compressed hyperbaric air in a diving bell for underwater repair on different ships or all different kinds of underwater needs. In 1918, Dr. Orville Cunningham discovered a difference in the mortality rate between flu patients living at higher elevations compared to patients living at lower elevations. In higher elevations, you breathe less oxygen. This discovery led to many flu patients seeking hyperbaric oxygen therapy treatments with great success. 10 years later, in 1928, Dr. Cunningham created a 5-story chamber that offered more than 60 rooms designed to treat flu patients. In that same year, Harvard Medical School built its first hyperbaric chamber. We'll talk about this a little bit down the slides, but in 1967, the Undersea and Hyperbaric Medical Society was founded, which has become the main accrediting body for hyperbaric programs worldwide. So definitely not something that has just taken hold in the last 20, 30 years. This has been around for hundreds of years now.
So when our patients arrive for their hyperbaric treatments, they come in their normal clothes. We ask them to change into hospital scrub pants and a gown that is 100% cotton. They're specially laundered. We don't allow any jewelry, battery operated devices, alcohol or petroleum-based products in the chamber. And the reason for that is that oxygen can be flammable, of course, in the wrong environment. So we're very picky and conscientious about how we treat our patients and what we allow to go in. We just lay them on the bed. As you can see, we make you as comfortable as possible, and you can have a couple of blankets, a couple of pillows. We do slide you into the chamber, then the door is shut, and we start pressurizing the chamber. The only thing that you really notice when a patient is in the chamber is when we pressurize the chamber, your ears fill up like you're flying in an airplane or driving through the mountains. And so that first 10 to 15 minutes, you really need to pay attention to your ears and clear them with various ways to do that. And we stand by and talk you through the whole portion of it. We do have 3 of the hyperbaric chambers, and we have 4 certified techs and another nurse that is working on her certification as well. So there's always someone available to be called at any time during the treatment. Our chambers are 41 inches in diameter, so they're the largest monoplace chamber, and you are able to move around in the chamber. You don't have to lay still. You can roll side to side. You can sit up. And it's not like when you're in an MRI or any other type of machine where you have to lay perfectly still. Our treatments last approximately 2 hours, depending on your diagnosis and at the depth of treatment that we have to do for each diagnosis. Next slide, please. So we do have several indications for treatment with hyperbarics, and they are all Medicare driven as far as what has been approved and researched through the Undersea and Hyperbaric Medical Society. They are the governing body that really does all of the research and helps keep things so that we know what protocols to treat patients with, and works with Medicare and gets all of our indications approved. Really, they do a great job with that. And so some of the treatment indications that we do here are late effects of radiation, osteoradionecrosis, which is damage to the bone from radiation, or soft tissue radionecrosis, which is also damage from radiation to soft tissue. We also do crush injuries, necrotizing infections, diabetic foot ulcers, compromised surgical flaps, and chronic refractory osteomyelitis. Next slide, please. We have had several success stories, of course, after we've been open since 2001 in the Wound Center at North Kansas City. So we have had multiple success stories over the years. Radiation cystitis is where you have had radiation to your bladder area, and you have had bleeding in the bladder when you go to the bathroom. And so we can, after multiple treatments, it does take quite a few, 40 to 60 treatments, but we have seen a huge difference in no more bleeding, no more pain for the patients. This is one of my favorite treatments to watch the patients progress with, because they have such a great improvement. So this is one of my favorites. Diabetic foot ulcer is, we do that. That is very common because there are a lot of diabetic patients in the world right now. So we are able to help salvage limbs, really. So where people don't lose their toes, their feet, and we do have some good success with that. One of the ones that you've probably seen on our YouTube channel as well is sudden hearing loss. One of our patients was a young man that came to us woke up one morning and just couldn't hear. And so he did some research and found out that hyperbarics could help with that. And that is one of the newer indications that has been approved through insurance companies. Medicare currently does not approve that. But for commercial insurance companies, we are able to call and get authorization and for them to cover this as well. So he did several treatments with some other medical treatments from his ear, nose, and throat physician, and we were able to make a huge difference in his life. So that was a lot of fun. He was very happy. That was good. And then necrotizing infections, we can actually, so what necrotizing is a bacteria that damages tissue, and it does not like oxygen. So we do fill the chamber with 100% oxygen, and it stops that bacteria from progressing, and we can decrease the amount of surgery people may need to have if they should have this type of infection. So we have had some great success with that also. Brandon?
Yes, I'll pick it back up from here. And like Kelly was saying, when it comes to writing the protocols for these indications, it's very important for us to have the science to back up what we're trying to do when it comes to getting insurance to authorize treatments. So we have a UHMS accreditation. It's a voluntary accreditation. Hyperbaric oxygen therapy centers are not required to have this accreditation. It's completely voluntary, and we've had ours since 2003. It is an every 3-year survey. Our last one was completed in 2021. I apologize, I got a little background noise. Every 3 years, 3 surveyors are sent to survey our center. It is a hyperbaric trained physician, a CHRN, which is a certified hyperbaric registered nurse. So someone trained specifically in the nursing portion of hyperbarics, and a CHT, a certified hyperbaric technologist. So someone who is specifically trained on the side of the technical component of hyperbarics. So one of each of those come to our center on site every 3 years to run through a whole gamut of what they call chapters and probes, which is basically individual regulations. There are about 24 chapters that have to do with all different kinds of things, which is, oxygen purity, patient education, administration, all the way down to, every bell and whistle, every technical component you could think of, they come through. It's very intensive, and they go through with a real fine tooth comb. But we have had that accreditation since 2003. It's something we're very proud of. Kelly, along with our other hyperbaric trained staff, are critical in those accreditation surveys. And it takes roughly 6 months to a year to prepare for those surveys. So it's not something you can throw together at the last minute. We are one of 3 UHMS, again, that's undersea and Hyperbaric Medical Society, accredited hyperbaric centers in the greater Kansas City area. And there are only a total of 6 in Missouri. So it is, it's a pretty small group of us that go for this accreditation and really volunteer ourselves to be gone through with that fine tooth comb so that we can ensure that patients have the absolute safest experience. Like Kelly said, it's oxygen under pressure. It is very safe. We make sure we do it absolutely correctly by the book, and we have that governing body of UHMS looking over us, again, voluntarily looking over us so that we know that we're always doing the right thing and have guidance should we have any questions or come up with a scenario that we hadn't seen before. One of the things that we often, or we ask every single time a patient may qualify for hyperbarics is, are there any implantable devices? It's something that we always want to make sure that we're keeping safety number one. And with so much different research and technology moving as quickly as it does, we really enjoy having that extra set of people that we know who are doing the research in hyperbarics to make sure that if someone comes in with a new device, whether it's a new diabetes monitor that are now implanted or heart device, different hardware somewhere in their body, we know that there are people at UHMS who are making sure that we can keep providing the safest care possible for our patients. So here is a quick photo of our team. Like Kelly and I have both mentioned, we do have this whole team is not trained in hyperbarics, but a handful of these people are. We do have, like I mentioned, a CHR and certified hyperbaric registered nurse, and we have 3 CHTs. Kelly is both a nurse and a CHT, so it's an awesome combination that we have. And like she said, we make sure that every patient that goes in has the highest level of safety in mind. There is always a staff member in the room that the hyperbaric chambers are in when a patient is in treatment. A patient is absolutely never left in that chamber alone. We also do have cameras above each of the chambers that make sure that we have an eye on patients at any given time. Also, as you saw in the photos, they are clear chambers, so we can keep in communication with patients at all time. There was a phone on the side of the chamber. Every chamber has a phone on the side. That way the staff who is conducting the treatment can keep in touch with that patient. And then should the patient in treatment have any questions at any time during treatment, they just have to talk. We can hear anything that's said when the patient's in treatment. So we ran through that. I just want to open it up to any questions that anyone might have. This is something that Kelly and I do every single day. So, we could talk about this, till the cows come home. This is something we do that it's almost one of those, we had to keep a pretty good lid on how far we were going to talk, because there's just so much that we could talk about and so much that we just have invested in this treatment for our patients. So we're happy to answer any questions that you all have.
So there are a couple of questions. One of them was, you had mentioned vision changes, and somebody asked if it can cause blindness, and how long does the vision changes last?
No, this is Kelly. And so the vision changes with the treatments can occur after about 20 treatments. And what happens is, when we're filling the chamber with oxygen, we're pressurizing it, and your organs, fluid-filled organs, get smaller. And then when we depressurize the chamber, they get bigger. The eyes are a fluid-filled organ. And so because we're doing that every day, treatments are Monday through Friday, anywhere from 10 treatments to 60 treatments. So it's a huge commitment for patients. And if you're doing that many treatments, then your eye is changing shape that many times. When that happens, it doesn't come back to the normal size right away, or the normal shape. It takes about 6 to 8 weeks after your final treatment for your vision to come back where it was previous to the hyperbaric start of care.
Okay, thank you. So another question is, it states, I had COVID and issues with my oxygen levels. Now I have brain fog and long COVID. Is this an appropriate treatment to help with that?
So I do think that there is some research that is going on with regard to that. However, because we're not a research facility, and the only treatments that we are allowed to do here are things that are Medicare approved indications, we're not able to do any research or any treatments for that. But I have heard that there is some research possibly going on with regards to hyperbarics and long COVID.
Thank you. Another question we had, you mentioned pressurized. Is there pain involved with the pressure on your organs?
There is not. So the only pain that you would possibly have was when we were first starting to pressurize the chamber, and your ears were not able to keep up with the pressurization. Sometimes, when you're flying in an airplane, you can't really clear your ear. You have to pinch your nose and blow gently. So that would be the only indication that you would have pain. And that's not something that we want. So what can happen is we can send you to an ear, nose, and throat physician, and they can put myringotomy tubes in, like they do for kids that have ear infections. And then you don't have any problems at all then with your ears being able to equalize during the pressurization.
Another question is, I have claustrophobia. Is there anything that you do to deal with the claustrophobia?
So the physicians can give you some type of anti-anxiety medication that can help with that. The chambers are very large. They're 41 inches in diameter. They're acrylic on the sides. You can see out. There's a TV that you can watch. If you are extreme claustrophobia, we have had patients say, I just can't possibly do this. The trial that we do is we say, okay, let's just have you go lay on the bed. We'll push you in. I can leave the door open. Let me know how you feel. If they say, okay, go ahead and shut the door. Let me see how I do. That's really kind of the test that we do to see if they could tolerate it. And at any time that you would want, I mean, the treatments last almost 2 hours, and that is a long time to be in there. However, the patients are always in control, and they can say at any time, you know, I need out of here right now for whatever reason. They had to go to the bathroom, or, you know, they aren't feeling well, or they just became too anxious. We can let the doctor know, and we can, you know, stop the treatment. Now that does count for your treatment for the day, and we don't, after you've gone to the bathroom or whatever, we don't put you back in. That's just your treatment. But that's kind of how it works for that. I did say something about a doctor also, and because we are dealing with oxygen is considered a drug by the FDA. So we have to have a hyperbaric trained physician in the hospital and close by before we would ever start treatments for that day. And so there is always a hyperbaric trained physician close to us in case we should have any problems, which, knock on wood, we don't have very often at all.
Another question that's here is, are there any wounds that are like too far that you would not treat?
So with the indications, each particular indication has to meet a criteria before it would qualify for a treatment. So sure, if there are things that are too far gone that we're not going to be able to help with, but we follow those parameters in order to determine if they qualify for the treatment. So there are certain parameters that we have to follow.
Absolutely. I'll follow up on that, Kelly. So one thing that we do, Kelly was talking about how there's a physician overseeing hyperbaric oxygen therapy treatment. Whenever someone thinks that they either have a wound that could use that or an indication that could use hyperbarics, they're always established in our attached wound center. So we have a 7-room wound center that's attached to the hyperbaric center, that every patient that would go in for hyperbarics is established in the wound center, seen and evaluated by a hyperbaric trained provider to make sure that we are ticking all those boxes and that the wounds that we are putting into the chamber are appropriate. And a lot of that comes with insurances now kind of have their own formulary, so to speak, of what they will treat hyperbarics with and what they won't. So a lot of that's just to make sure from the get-go that the patient's being evaluated appropriately. We are putting the correct wounds into hyperbarics, and that we can give all the insurance that's required, or the information that's required to the insurance to ensure that no one ends up with a bill that they weren't expecting.
And speaking of insurance, that was another question. It says, you mentioned Medicare, but not other insurances. Do you take other insurance?
Yep. So we follow the hospital. We are a department of North Kansas City Hospital. So any insurance that is taken by North Kansas City Hospital, we take as well. The Medicare versus commercial payers came specifically up when it came to that sudden hearing loss. So sudden hearing loss is something that is covered by, I'm hesitant to even say most. I'm going to start with some and kind of go from there. Commercial insurances, so your Blue Cross, your Humanas, United Healthcare, Aetna's. I believe the patient that we had for sudden hearing loss was an offshoot of Blue Cross, whereas Medicare itself, traditional Medicare, does not cover sudden hearing loss as a hyperbaric oxygen therapy treatment. The other indications that we treat hyperbarics for are all generally approved by insurance, but we always do a pre-authorization with your insurance before you go into treatment.
Okay. Well, that's all the questions that I have on the list. Is there any final words that Kelly or Brandon that you want to tell the participants?
I've seen a lot of success, and it is it's not the only treatment that would be utilized. It's a treatment that is in conjunction with other treatments. So it's not a one and done treatment. And like I said before, it's anywhere from 10 treatments to 60 treatments. So it's a huge commitment for patients. It's almost a full-time job. And some of our patients, have to work. And so it can be very difficult to get in there and get all your, and work it out with your job. But most employers then are willing to help out. So.
What are the hours that you have patients come in?
So we do hyperbarics from 6:30 in the morning to 3 o'clock in the afternoon. That's because, again, we have to have a physician hyperbaric trained in the house and close by. So we do not have 24-hour coverage here.
Okay. Well, I want to thank you both. That was very informative. Excellent presentation. So I thank you both for coming on today. And again, we are recording this, and this will be posted on the North Kansas City Hospital YouTube channel for you to view in the future and to share with your friends.
Thank you, Sandy.
Thank you both
Thank you for
very
having us.
much. You're welcome.
Thank you.
Bye now.
Bye.
Bye.
Holy man.